Knee pain can happen for many different reasons, but there are three critical warning signs you should never ignore. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine doctor currently practicing in the San Francisco Bay Area, and after treating thousands of patients with knee pain, I've found that the same three warning signs consistently point to something serious going on. So in this video, I'm going to break down what those signs are, why they matter, and what you should do if you notice them. The first sign you should never ignore is persistent or significant swelling. It's normal for your knees to feel sore after a long run or a tough workout, but visible swelling that lingers more than a few days is different. Swelling means fluid has collected inside the joint capsule, something we call an effusion. That fluid isn't supposed to be there, and it usually signals that the joint is under stress or has been injured. Swelling happens because your body is responding to damage. When cartilage, ligaments, or the meniscus are injured, or when arthritis flares up, the immune system releases inflammatory molecules that draw fluid into the joint. This extra fluid creates pressure, and that can lead to pain, stiffness, and loss of range of motion. Research shows that recurrent effusions accelerate cartilage wear because the inflammatory environment inside the joint actually breaks down collagen and proteoglycans. These are the building blocks of healthy cartilage. In other words, swelling doesn't just hurt, it speeds up degeneration of the knee. The second sign you should never ignore is locking, catching, or giving way. These are what we call mechanical symptoms, and they almost always point to structural damage inside the knee. Locking happens when you literally can't straighten or bend the knee because something is physically blocking the joint, most commonly a meniscus tear or a loose cartilage fragment. Catching is a milder version where the joint hesitates or grabs during knee motion, and giving way is when the knee suddenly buckles or feels unstable, often tied to ligament injuries like an ACL tear. Why are these symptoms so concerning? Because they usually mean the smooth surfaces of the joint aren't gliding properly. The meniscus and cartilage are designed to distribute weight evenly and allow nearly frictionless movement. But when they're torn or damaged, they can shift out of place and block motion. And over time, this abnormal movement causes more cartilage wear and increases the risk of osteoarthritis. Studies have shown that patients with knee instability have faster progression of joint degeneration compared to those who get timely treatment. Now, it's worth pointing out here that clicking or popping by itself is different. Many healthy knees click or make noise without it meaning something is wrong. When you should be worried about is when the knee actually gets stuck, when it catches painfully, or it gives out unexpectedly. Those are the signs of a structural problem that shouldn't be ignored. The third sign you should never ignore is an inability to bear weight or severe limping. After exercise, it's normal to feel sore or stiff, but you should still be able to walk normally. If you can't put weight on your leg or if every step forces you into a limp, that's a serious red flag. This usually means the joint, the ligaments, or even the bone itself has sustained a significant injury. Weight-bearing capacity is one of the most telling indicators of knee health. Major ligament tears like an ACL or an MCL injury can leave the joint unstable under load. Meniscus tears that flip or displace can make it way too painful to support weight. And deeper in the joint, subchondral bone marrow edema, essentially stress reactions within the bone seen on MRI, can be a source of severe pain with every step. These are sometimes precursors to stress fractures. In older adults or after high-impact trauma, an inability to walk may even point to an actual fracture that isn't always obvious seen on initial x-rays. In fact, research has shown that the inability to walk 4 steps is one of the most predictive findings for fractures, and it's used as a cornerstone of the Ottawa knee rules used in emergency medicine. Knowing these pain signals is important to recognize when something serious is going on, but the location of your knee pain can also give powerful clues about the underlying diagnosis. That's why in my next video, I'll walk you through the most common causes of knee pain based on location. You'll learn what each pattern of pain usually means and how to use that information to take the right next steps.